Hey guys! Before explaining and demonstrating about heart rate and how to count or measure them, I would like to share some information of why knowing our heart rate is important. Checking our pulse is for us to find out if our heart is pumping enough blood and for us to check if there are any irregular or abnormalities on its beatings. One example of why we need to know about the importance of heart rate is when we got into an emergency situation. Checking the patient's heart rate is a way to know if he or she is still breathing properly or not. But of course, we need to know how to do it properly. So first, using our two fingers, the index finger and the middle finger, we need to place it to a part of our body where we can easily feel or locate a beating or a palpation. There are different places in our body that pulse can easily be located. It could be on our wrist, on our inner elbow, on our bicep, on our neck, on our temple, and also it could be found on our feet. But of course, we need to know how to calculate our heart rate, right? So in 15 seconds, we need to count how many beats are there and multiply it by 4, and that is how you get your heart rate. So first, I'm going to demonstrate of how to get our temporal pulse. Temporal pulse is on our temple. So using your two fingers, we need to place it in front of our ear and beside our eyebrow, which is here. Apply a gentle pressure and you can easily feel it and use the formula on how to get the heart rate. Second is the carotid pulse. So using our two fingers again, it is located on our neck. So it's either side of our neck. So we can use any side of our neck. So using our two fingers, place it under our jawline or near our windpipe and apply a gentle pressure on it, and you can easily feel the beating. If you are following me, then nice. Next is the brachial pulse. It is located in our arm. So just raise one arm and using the two fingers, place it on our biceps. You can also use your inner elbow instead of your biceps. The inner elbow is where you can easily find it, the pulse, and it is the most common area where we can find the pulse, the brachial pulse. So just apply gentle pressure in it and use the formula and you can already get your brachial pulse. So the fourth and fifth are kind of similar. It is the ulnar pulse and the radial pulse. So just open your palm facing upwards. So I'm just gonna do this. Your ulnar pulse is along your pinky. Along the pinky is the ulnar pulse. So here, just apply a pressure in it and you can easily feel the pulse. While the radial pulse is along your thumb. Just along your thumb and count the beating in 15 seconds and you can easily feel or get your heart rate. So a quick recap. Temporal pulse could be found on our temple, carotid on our neck, on either side of our neck. Brachial pulse could be found in our biceps and our inner elbow. And the ulnar pulse and the radial pulse can be found on our wrist. There are many factors that could affect our heart rate. Like many factors. So I was just gonna state 10 common factors that could affect our heart rate. So first is exercising, high temperature and humidity, the position of our body, especially when we are upside down, and emotions, obesity, medications, nicotine, caffeine, diet pills, and low blood sugar. So for medications, it depends on the medicine. For example, the doctor will prescribe a cardiac patient a medication and it could decrease their heart rate. And for thyroid patients, it would increase their heart rate. It really depends on the medication or the medicine that the doctor prescribes the patient. So, but of course, you know that there are different heart rates, right? Like an athlete's heart rate and a non-athlete's heart rate. They are quite different. So since athletes use their body energy and cardio much more than the non-athletes, so they have a lower heart rate and a large left ventricle internal diameter and wall thickness. So they also recover much more faster than the non-athletes since they are already immune and trained much more longer than non-athletes. While us non-athletes, we need to train more about how to properly use our breathing and our muscles and energy. So it's really quite different. So yes, I hope you guys learned something from this video. And please take care of yourself, your body, especially your heart. Yes, take good care of them and live a long and healthy life. Stay safe and healthy, everyone. Bye!